In this video, we will go over the different remedies and treatments for TMJ or TMD, also known as temporomandibular disorder. Most of the remedies for TMD are very conservative measures that can be done in the home, and a few are complex and need to be done by a professional. As always, I will break it down so it is as easy to understand as possible. I am Rick Buck. I've been a dentist for 15 years, so like and subscribe if you have teeth. I've been on a journey to help people find real relief to their jaw pain, not just help them mask their pain. So, this is one of 3 videos I made on TMD, and this information will make most sense if you watch those other videos as well. Here's why. Your body is made to adapt and compensate for so many malfunctions in the body. In fact, your body has pre-built into its system mechanisms that will try and deal with each and any problem it faces. Each mechanism will produce a set of symptoms, like the ones you're having with your jaw pain. Once we know the mechanism or pathway happening in your body, we then want to find out what is triggering that mechanism, and this is what the root cause of your symptoms is. Once we know what is triggering the mechanism itself, and the symptoms, we can then know what remedy will work best for us and what remedy is going to help the root cause of the problem once again. To make it easy to understand and illustrate what I mean, if you were choking, a symptom would be turning blue in the face. The mechanism would be a lack of oxygen to the lungs and the blood. That's why your face is turning blue. The trigger would be the candy that got lodged in the trachea that prevents breathing and oxygen to the lungs and the blood. The remedy would be the Heimlich maneuver, or even just coughing up the candy or whatever is lodged. But that's the remedy to treat the root cause. If you just treated the symptom of turning blue in the face, you could apply makeup to the face and make your skin a more peach and lively color. But that obviously won't help the root cause, and you'll probably end up dying. Or if you treated the mechanism of lack of oxygen, you could just administer oxygen while someone is choking. But that obviously will do nothing to unblock the airway, obviously likely ending up in dying as well. You could also treat the mechanism and not the root cause by doing a tracheotomy or putting a hole in your trachea so that you can breathe. But wouldn't you want someone to have tried the Heimlich maneuver first? You must deal with the main issue, is my point. Now, that's not to say that you can't treat symptoms and mechanisms to help you feel better. In fact, that is pretty much what modern medicine is in a nutshell. But the most optimal treatment is to take care of the root cause first. And then if that fails or can't be done, you can move on to other remedies and treatments. Watching all my videos on TMJ after this one will help you understand why you're having the problems and better equip you to find a relief from this video. So let's get on to your problem by talking about clenching. Some 85% of TMJ issues are due to overusing the jaw muscles, as I explained in my other videos. Almost everyone clenches their teeth, but some people do it more than others, and at certain points in your life, you will do it more than other points in your life. The question is, for people that have TMJ issues due to clenching excessively, why are we suddenly doing it excessively? The short answer is that our jaw muscles seem to be very sensitive to mineral and hormonal imbalances in our body, and they clench when certain things get out of whack or imbalanced. Watch my other videos for why, but here are 9 things that I go over with my patients that normally stop excessive clenching. Now, these 9 remedies and things I have my patients do take care of almost all of their TMJ problems before we have to go into treatment. And I figured these out by reading journals and studies, and also just talking extensively to my patients about why they might be having jaw pain. First, I have them stop all vitamins and supplements that are not prescribed by a doctor for 2 weeks, especially vitamin D, calcium, and metals they're taking like iron and zinc. I take some of those supplements, so I'm not against taking supplements, but everyone is different, and the only way to tell if vitamins are affecting you is that if you stop and you see what happens without them. This alone works for about 25% of my patients. So that's the first thing I do. Second, I have my patients go to a balanced diet if they are on an abnormal or restrictive diet. You see, you may not even realize it, but you may not be getting certain things if you're on some sort of extreme or restrictive diet. Third, if my patients are on an intense workout program, especially one that pushes you to the point of exhaustion, then I have them go on a way less intense workout for a few weeks. I have just seen tons of people that work out excessively, like heavy runners and CrossFit people that just clench their teeth a ton. Fourth, we carry a water bottle to make sure people are hydrated and cut caffeine out for a few weeks, as caffeine will dehydrate you. It should be noted that cutting caffeine can initially make TMJ worse and give you headaches, but as your body starts to rest appropriately and acclimate with better sleep cycles and with better hydration, it should help relax the muscles. And that tip will help with my fifth recommendation. Make sure you are getting enough relaxation, rest, and de-stressing time. Even if you have to set aside some meditation time, make sure that you get a break from your stress and relax, however that may be for you. Stress is an obvious reason for clenching. Everybody knows about it. So make sure you get some time to just relax and de-stress. Sixth, we get rid of hard pillows for a few weeks. Sometimes we even use no pillow, which might feel really odd at first. And for some people with long-term back problems, this might be impossible, but the change in neck position may be just what you need. I've seen so many times people think that they're using hard or memory foam pillows are good for them. They stop using them and it just calms all the neck and jaw muscles down. If those things don't get rid of any clenching issues, then we move on to 3 final possibilities, all which involve talking to their doctor about a few possible changes. So now moving on to the 7th, I have the patient talk with their doctor about the medications to see if we can lower a dosage to find an alternative to their medication if they are taking them. There are many medications known to cause clenching. For example, Prozac and other depressants. They can also cause clenching, but there are some that aren't known that I'm almost sure cause clenching. For example, Afrin, the nasal decongestant, it tends to cause clenching from what I have seen, although it's not known, it's not written on the bottle. 8th, sleep apnea can also cause clenching. So if this applies to you, you can talk with your doctor about getting checked for sleep studies so that you can find out if you have sleep apnea. It may sound counterintuitive, but people that have sleep apnea, when they're not completely relaxed, they clench so that they don't relax and to keep their airway open. And 9th, and this may be counterintuitive to what I just said a couple of seconds ago, but if there's any sinus issues, you can talk with your doctor about relieving that with temporary decongestants or allergy medications. But you need to know some of those sinus medications, from what I have seen, have actually caused clenching. Doing these things will help find what is causing the excessive clenching for most people. I wish I could say these work 100% of the time, but it is just the best place to start, as these are the most common causes of jaw pain from what I have seen. And once again, these are the root causes. So when you are treating something, you want to start with the root causes, and if those don't work, and if you can't find that root cause and what's triggering the problem, then you want to move on to treating the mechanism of what is going on. Before I go on to the other remedies that will help you get rid of your TMD, I want to plug my best daily brushing and flossing routine video. It will show you how to optimally take care of your teeth with all the best products that I have tested out in other videos I have made. These products include my favorite floss, toothbrush, and toothpaste by far, and you can see why they are my favorite with stunning results in a video that will pop up at the end of this video. Like clenching issues, there are other things people do to voluntarily overuse their jaw muscles, which would take other remedies than the ones we just mentioned. Mostly this involves chewing too much. So for a few weeks to get rid of the chewing too much and just relax your jaw muscles, it's good to go on a soft food diet, so we give the jaw muscles a chance to just rest. This involves not chewing anything that involves opening too wide or chewing too much or chewing too hard. So avoid chewing things like gum, nuts, and beef jerky. Gum, people just chew way too much. Nuts, people chew way too hard. And beef jerky, just kind of a combination of too much and everything. But also avoid things like thick sandwiches and burgers that make you open just really wide. I would do this once again at least a few weeks until things calm down, and possibly for good if you feel like these things are the main culprits triggering your TMD. Moving away from overusing the jaw muscles in general, jaw position is something else we covered that can cause TMD. If your jaw is in a bad position long enough, it can cause many issues related to TMD. So let's go over some of those. If you recently had dental work, or even if it isn't recent and you feel like your bite hasn't been the same, it is a good thing for the dentist to adjust and slightly file down the work, whether it's a filling or a crown, until you feel like your bite is even again. If your bite has been out of place for a long time, this may be more difficult, as things can start to readjust to the bad jaw position, and it stays that way almost permanently. So the sooner you can get in to have things like that adjusted, the better. Now, these are how you directly find relief of the root cause level by reversing whatever is setting off your TMD. But let's get into other remedies for those that can't find relief from the root cause level. TMD normally has inflammation involved somewhere in the process, whether it is in the muscles or it is in the joint itself. So I normally have my patients take the recommended adult dosage of over-the-counter ibuprofen for 3 to 4 days if they can take ibuprofen. This isn't just for pain, but because ibuprofen is an anti-inflammatory. Some people have stomach issues that prevent them from taking ibuprofen. So I will sometimes prescribe another anti-inflammatory called Medrol, and only your doctor or dentist can prescribe that. Or they can take something else called omeprazole a little bit before taking ibuprofen, which will cause the stomach to calm down so that they are better to take ibuprofen without its bad side effects. Next, you can use a hot and cold compress to help deal with TMD. What you do is on the side of the jaw, alternate warm heat and cold compresses for 10 to 15 minutes with one, then switch to the other. You can do this 3 times a day, and it will really help to loosen things up by doing on with cold for 15 minutes, maybe rest for a few minutes, then put heat on for 10 to 15 minutes, and so on. Another remedy is to do a massage on the masseter muscle. While in a warm shower, put your thumb on the inside corner of your mouth, as seen here. Put your index finger on the masseter muscle and lightly massage the muscle for a minute or so. And if the thumb and the index finger don't work how I said it, you can instead do the index finger on the inside and the thumb on the outside. Don't put any more pressure on the masseter muscle than what gives it only a slight discomfort. You don't want to put as much pressure that makes it in pain. If TMD is also causing you to not be able to open wide, there are many little stretches you can do with your jaw to open wider and function better. I won't go all these kind of little physical therapy things you can do right now, but there is one that typically works really well and is done most of the time. What you do is you put your fists under your chin and slowly open while putting enough resistance with your fist to not let it open. You do this for about 15 seconds and then rest and repeat it 2 more times. And do that 3 times a day. These are little exercises that everyone can do to hopefully find TMJ relief, but if those don't work, then we sometimes have to have professionals help treat the TMD. So if you have to find a professional, the first place you can go is a dentist's office. We do a few things to help find relief. The first thing we can do, as I mentioned earlier, is adjust the bite. Normally, I start by filing down any crown or filling that might be high so that the bite is only on natural teeth and not touching the dental work, especially any recent dental work that we did. And sometimes that alone does the trick, so everything relaxes and the bite feels better. Then I make further adjustments if needs be. And if just adjusting the dental work doesn't work, then sometimes I actually adjust the teeth. And that's most of the time for people that have let it go too long, and I need to now adjust the teeth that are out of place as well. The next thing we can do is make night guards. Unfortunately, many dentists start with the night guards. And while sometimes it is appropriate, most times I have found it doesn't help, especially if it's done when it isn't really indicated. Now, you may be asking what a night guard is. Night guards are little custom splints you wear at night when you sleep. They do take a little bit of getting used to for some people more than others, but night guards do 3 things. It evenly distributes the pressure of your bite onto all your teeth and the night guard. So that way, one or a few teeth don't take the brunt of the force causing pain. It also prevents the wearing down of your teeth because when you grind at night, you grind away the night guard instead of your teeth. The last thing it does is act like a splint so that when done correctly, your jaw rests in a favorable position at night. Hopefully then, the night guard can help the jaw recuperate and hold things in the correct position, and that's how it acts like a splint. However, if done incorrectly, night guards can do nothing or even make things possibly worse. Using a night guard as a splint gets limited results in my opinion. I shy away from using night guards as a splint, especially as the first line of treatment, due to the limited results that they get in both practice and from what I've seen in studies. The next thing dentists can do is deliver botulinum toxin for TMD, or better known as Botox. Only a few dentists that I've seen do Botox. In fact, I'm one of only a few in my area that does it for TMJ, but Botox is a muscle relaxer. It helps the jaw pain because you deliver it to the jaw muscles so it limits the amount of involuntary movements of the jaw. Over time, this relaxes the jaw muscles so they aren't so tight, fatigued, and sore. As opposed to night guards, Botox works 24/7 to limit clenching and grinding, not just at night. I have found Botox to be much more helpful than night guards. It gives relief every time I do it, but there is a question of how much relief. For some people, it's about 30%, and then I have to give a little bit more, and then others, it's 100% of the time. But it does vary from person to person. Most of the time, it wears off anywhere from 4 to 6 months. However, for a few people, Botox will completely heal their TMD. So if you have tried everything else up to this point, I would recommend Botox treatment. You might be one of the lucky ones that all their pain goes away for good, but if not, at least you know what it will do and can decide if you want to continue every 4 to 6 months. For some people, this is really worth it. If you live in Southern California, my office is in the description of this YouTube video. While Botox is a muscle relaxer for individual muscles, some dentists will prescribe muscle relaxers to take at night, and it will work much like Botox will. The big difference is, as opposed to Botox, taking the muscle relaxers by mouth will relax all the other muscles too, and it will make you drowsy. So therefore, you have to take them at night, and it does make you drowsy. Another thing that dentists can do is give trigger point injections. When your jaw muscles clench too much, they get little hyper-irritable spots in them. We commonly refer to these hyper-irritable spots in the muscles as knots. One way of treating this is just sticking a needle into the knots, and this is called a trigger point injection. This tends to break them up so they can heal and hopefully reset and relieve some of the muscle-induced TMJ pain. Along those lines, you can see an acupuncturist and get some acupuncture for the jaw, and this is proven to give relief and reduce TMD severity too. The next professional you may want to visit is a physical therapist. They can go over many of the therapy treatments to help restore normal function to your jaw. One of the more popular exercises I have already went over. As a part of treatment, sometimes they will do electrical nerve stimulation using a TENS unit, which also helps relax your muscles. Chiropractors can be another professional that can be a benefit for restoring the TMJ. In addition to adjusting the back, chiropractors can adjust the jaw joint or pretty much any joint. I have a close friend who had a long-term TMJ issue, went to the chiropractor, and the chiropractor was able to pop it into a better position. All their issues were gone after that for good. Now, I wouldn't go in expecting it, but it may work for you. And seeing a chiropractor may work better if it seems it was originally an injury or trauma that set off your symptoms of TMD. If my patient has arthritis or there's a suspicion of arthritis, then seeing a doctor to find the prescription or protocol for relief will be the route for correcting the arthritis-induced TMD. I won't go too much into that because it's another professional's expertise. But now let's say you've tried all of that and you've done everything and nothing seems to work. Then the option is to have jaw surgery and or braces. This is the last resort because jaw surgery gets only temporary results for a lot of people. But there are two types for the TMJ. The first is jaw surgery on the disc of the TMJ capsule that holds the jaw into place. The second surgery is surgery to move the jaw into a better position. Braces, to a limited extent, can also help move the jaw into a better position. In fact, sometimes in conjunction with jaw surgery, they will also do braces to help make the jaw and the bite more favorable in both ways. Surgery is normally the last resort, not just because of how invasive it is, but also the results vary quite a bit. In fact, some people that do get relief from surgery only get temporary relief, as everything can return, but they didn't take care of the main issue. Everyone should watch my daily tooth care routine video I have posted now, and I will show you why in that video it is the best way to brush, floss, and more. Now continue to watch my other 2 TMD videos. I understand it can be very difficult to find the root cause of TMJ pain, which is why I recommend taking it step by step to find out what is causing your pain. Watch my other videos so you can maybe narrow it down and find exactly what is causing your issues. Watch one of those videos now.